Hi, my name is Sarah. I am a registered veterinary technician here at West Park Animal Hospital. Today I will be showing you how to draw up and administer insulin to our dogs. Diabetes is a very common disorder that our older dogs get. Sometimes the dogs lack these cells to produce insulin in the body. Luckily, there is insulin therapy that the dogs will require for the rest of their life, along with diet changes. Diabetes in dogs is a lot like type 1 diabetes in people. The two very most common insulins that we have for diabetic dogs is one is called Insulin. This is a porcine-derived insulin that we use U40 syringes for. Next is Humulin, also called Novolin N. This is a human insulin that we use U100 syringes. We also sometimes have insulins that comes in pens, and I will show you how to draw up all of these. When it comes to syringes, we have two different types, the U40 and the U100. Insulin syringes, they can either come in 1 quantities, which are on this side. Some insulin syringes also have half quantities if your dog gets 5.5, 6.5 units that are usually on the other side. The top line is always 0, so when it counts down half, 1, 1.5, 2. So when it comes to the insulin bottle, you're always going to keep insulin in the fridge. While it's sitting in the fridge, it does settle to the bottom. So the best way to mix it up is to roll it in your hands very gently. You never want to shake an insulin bottle. That can actually break up the insulin molecules and pretty much render your insulin useless. So we'll shake it very, very gently in our hands until it's all mixed up. And then when you're ready to draw up, you will take your insulin syringe, take off the cap. You will take the bottle upside down. You will see this sometimes white, sometimes gray plunger, and you will pop it in there. You always want to draw more than you absolutely need. So if we want 5 units, we're going to draw a little bit more. This allows all the air bubbles to go to the top. And then we're going to count down from 10, 9, 8, 7, 6, and 5. And then you're going to take it out, place your insulin back in your refrigerator, place the cap back on. Now I will show you how to draw from the pens. These are Humulin grade. They come with little caps on them for people to administer to themselves, but we are going to draw it up the same way with a syringe. So you'll take your syringe, take the cap off. You will take the cap off the pen. You will also find the little gray plunger here. You're going to inject the needle. Again, draw more than you need. Wait till it fills up. And we're going to count back down 10, 9, 8, 7, 6, and 5. Pull out. Put our cap back on. This cap back on. Put it back in the fridge. Now, I will show you how to administer our insulin to our dogs. Now I'm going to show you how to administer insulin to our dogs. This is Winston. He's one of our babies here. He's going to help me today. Insulin is given subcutaneously, which is just a big word for underneath the skin. The best place to give insulin is in between the shoulder blades. You can do it farther down the back if needed, but in between the shoulders is the best. To give insulin, you're going to take your index and your thumb finger. You're going to grasp a small piece of skin in between, pull up to create a tent, and you're going to feel a little pouch right there. So we're going to take our insulin needle. We're going to take our index and our thumb finger, grab a little piece of skin, pull up, feel the pouch. We're going to go at a 45-degree angle, and you're just going to feel it pop right through the skin. You're going to take your middle finger and gently pull back. Make sure you don't get any blood, and then you're going to inject it into the body. If for whatever reason you get any blood, that is okay. There are a lot of blood vessels underneath the skin. You're bound to hit one of them. Just take the needle out, start all over. After you administer it, just make sure the area is dry. If for whatever you feel any wetness, you might have just gone completely through to the other side of the skin. That's okay. You can immediately start over. Afterwards, I will then share some tips and tricks on feeding. Insulin injections should always be given very consistently and per the recommendation of your veterinarian. Insulin injections are given every 12 hours and always within 30 minutes of a meal. If your pet is a very good eater, you can always give it during the meal, or you can wait till after the meal and give them a special treat that they only get with their insulin. If your pet were to ever skip a meal, you are allowed to give half a dose of insulin. So if he gets 6 units, you can give 3. If he gets 5, you can give 2.5. If for whatever reason your pet skips 2 meals in a row, never give any insulin and give your veterinarian a call right away. There are different types of prescription diets that we do recommend for our diabetic friends, so please always talk to your veterinarian first. Thank you for watching our video. I hope this was helpful to you. If you ever have any questions, I promise you there's no such thing as a stupid question. Always please call your veterinarian. Thank you.